Hello, my name is Harsha George. This is session 3 of the Acceptance and Commitment Therapy series. I started making these videos specifically for my colleagues who wanted to familiarize themselves with ACT techniques because ACT has been accepted as an evidence-based model of therapy by various organizations like the WHO, the APA, the US Department of Defense, California Evidence-Based Clearinghouse for Child Welfare, and so on. And also because of its increased popularity among clinicians in the last decade. My ACT knowledge is limited to my review of resources made available by Dr. Russ Harris on his website. In this session, I would like to introduce the main principles of ACT. Just wanted to remind you again that I don't consider myself an ACT expert, just an ACT lover. There are two basic aims in ACT. One is to create a rich, full, meaningful life. And the second one is to be psychologically flexible. When you live a rich, full, and meaningful life, it involves experiencing the full range of emotions. And therefore, the aim is not to eliminate distress, but to sit with distress in a different way and increase your psychological flexibility in that in turn. What are some of the risks which can also be explained to the client as part of the informed consent? ACT is not one of those therapies where we talk about your problems. ACT can be hard work and involves experiencing significant distress. Learning, applying, and practicing skills in between sessions requires commitment. What are therapist-client roles in ACT? Clients and therapists are on the same boat. Therapist's life is not completely in order. The client and therapist are climbing their own mountains. Therapist has not reached the top and is not having a rest. From where the therapist is on their mountain, they can see obstacles on the client's mountain the client cannot see. Therapists can point those out to the client, and the client can then choose some alternative routes around them. Operating principles. ACT is acceptance focused and whole life focused and not on very specific problems. ACT is not focused on very specific problems. Problems are not ignored but are looked at in a broader context. No labels, although this can be tricky when it comes to sending reports to funding bodies. But given that, we try not to use labels because as soon as a private experience is called a symptom, it immediately sets up a struggle with it. Clients are taught how to transform their relationship with thoughts and feelings so that they no longer perceive them as a symptom. Although thoughts and feelings may be uncomfortable, they are harmless and transient. There is an important concept called self as context that is really important for us to explain to our clients before we begin therapy. Self has an identity that is separate from the body and mind because it can observe thoughts, feelings, and sensations. Self is the locus from which a person's experience unfolds, the observing self, the core you. And self is a context using which we can take different perspectives. I recommend watching the Internal Struggles video on YouTube by Dr. Russ Harris, where he compares the self to a chessboard. I also recommend these YouTube videos by Dr. Russ Harris. One is called The Struggle Switch, in which he explains the problem of struggling with our thoughts and feelings. And the second one is the three happiness myths. In the three happiness myths video, Dr. Russ Harris discusses the first myth, which he says is happiness is the natural state for human beings. The second myth that he discusses in the video is happiness means feeling good. And the third myth that he tries to address in that video is if you're not happy, you're defective. So you can see how these three happiness myths, which is also called the happiness trap, can lead to us trying to control our emotions and thoughts, which can in turn lead to problems. So what exactly is the problem of avoidance, and how do we convince clients that avoidance is a problem? So ask your clients, what are the different ways in which you have tried to get rid of or avoid unwanted feelings and thoughts? Did you succeed in permanently getting rid of them? Did this reduce your symptoms in the long term? What did this method cost you in terms of time, energy, health, vitality, and relationships? Did it bring you closer to the life you want? Another example is tell them, don't think about your favorite ice cream or forget what happened this morning. And if you can remember some of the old movies in which you see the actor struggling in quicksand, the more you struggle, the faster it sucks you under. So the way to survive in quicksand is to lie back, spread out your arms, and float on the surface. Another important beginning point for therapy is a concept called workability. So examining whether the client's behaviors help them to create a rich, meaningful, and vibrant life. Awareness of one's behaviors and whether those behaviors are working. So that's workability. Working in effectively solving the problem and of moving one toward valued ends. So does it move them closer to their values? So for example, if his or her use of alcohol as a distraction strategy is working in the long run in solving the problem of anxiety. Examine the cost of using this strategy on values. And values have a different meaning than what we normally use in ACT. I'll get to that later. Non-judgmental identification of unworkable behavioral patterns motivated by short-term symptom relief to facilitate behavior changes that are aligned with long-term valued ends. Willingness. What's the concept of willingness? Willingness is allowing yourself to experience what you're feeling, allowing yourself to be where you're at, even if it's uncomfortable or painful. Dropping your resistance to distress that is already there and that will likely come and go. Easing into it. And why do we do that? To free up the energy you were using to fight it, to start doing what matters to you. And that's what values are. So there's no point in struggling with distress that's already there because it's not in your control to it's not in your control to eliminate it. So these are the videos I will also recommend by Dr. Russ Harris, The Unwelcome Party Case, Monsters on the Boat, Passengers on the Bus. Please watch them, and these videos will also help you to understand the concept of willingness better. So I shall stop here. In the next session, I will talk about the ACT triflex and also introduce a few more techniques based on ACT therapy, on the ACT model. So thank you for your patience.